This talk will introduce you to some principles of communication and situational awareness that will help you to lead codes effectively. Codes are undeniably stressful, not only because they literally involve life and death, but also because they involve multiple role players who may never have worked with each other before. To save a life, order needs to be established out of the chaos quickly, and a group of strangers needs to become an effective team. The concepts discussed in this talk will help you do this. Even as a resident, you are likely to act as a code leader. When responding to a code, your first responsibility is to identify yourself loudly and clearly. Many residents feel hesitant to do this out of fear that someone more senior is already on the scene, or because they would prefer, understandably, to not be in the spotlight. You must overcome this hesitation in order to establish an effective team. As you walk into the room, identify yourself by name as well as your role to everyone present. If another physician is already present in the room, introduce yourself and quickly establish who will run the code. If there is no other physician present, assume you are in charge. The following video will show you how not to approach this situation. Pay attention to the interactions between the characters and take a moment to ask yourself what you would do differently.
Hi, Mr. Johnson. I'm just going to hang some antibiotics on you. Mr. Johnson? Mr. Johnson, are you okay? Mr. Johnson? I need some help in here. Can someone help me?
Hey, Angela, what's going on?
I just found him unresponsive. Can you call a code and get the crash cart?
Okay.
I just need help. Okay.
I got the code cart.
Have you seen the doctor?
Oh, I haven't seen him. Should we do CPR?
Yeah, I'll start chest compressions and you get the bag. You get the bag.
Okay.
What's going on?
Are you the doctor for this patient?
I'm just carrying the code blue pager.
Okay, well, I don't even know. He's not my patient. I just came in and found him unresponsive like this.
Does he have a pulse?
I don't think so.
Well, what's our rhythm?
I don't know. He's not attached to any pads.
Can we get him on a monitor and give some epinephrine?
Yeah. Okay, you bag and I'll get the epi.
Okay.
Yeah, let's get some epinephrine. Where's anesthesia?
The video shows a number of poor leadership and communication behaviors. The providers seem unclear on their roles in the resuscitation, as well as their overall management priorities. The resident does little to improve the situation, asking open-ended questions rather than giving instructions. When running a code, you must quickly assess the situation and establish management priorities, addressing the physiologic targets which lie at the heart of every cardiac resuscitation: circulation, oxygenation, and ventilation. Think out loud to the other team members present so that they understand the plan, and don't be afraid to rely on a cognitive aid, such as a CPR card, to help you. Delegation is essential to effective code leadership. In order to maintain perspective, it is important that you not get drawn into performing tasks during the code. The code leader should not perform CPR, push medications, or manage the airway. These actions will draw your attention away from the big picture and inhibit your ability to communicate. Establish the key components of your resuscitation team with any providers available. The following video shows a vignette similar to the one you just saw. Again, pay attention to interactions between the characters. This time, try to identify communication strategies which make this code run more smoothly.
Hi, Mr. Johnson. I'm going to hang your antibiotics now. Mr. Johnson? Mr. Johnson? Mr. Johnson? I need some help in here.
Hey, Angela, what's going on?
I found him unresponsive. I need you to call a code and get the crash cart.
All right, I'll call the code.
OJ, I need you to attach the pads to the patient.
Okay.
Respiratory therapy, how can I help?
Can you start bagging the patient, please?
Hey guys, I'm Dr. Evans from the MICU. What's going on?
I found Mr. Johnson unresponsive. He doesn't have a pulse. We've started bagging him in chest compressions.
Okay, keep bagging him. The compressions are good, a little faster. I have a great pulse with those compressions. Let's go ahead and give a milligram of epinephrine. Please draw that up and administer it.
All right, 1 milligram epinephrine coming up.
This vignette shows a number of more effective communication strategies than we saw in the previous code. The providers refer to each other by name or by title, and role assignments are made clear. Communication is direct, and management priorities are clear to all providers. The following are the essential roles which must be filled in order to create an effective code team. CPR providers. You'll need more than one person to perform CPR. As CPR is initiated, establish who will relieve that person immediately. CPR quality decreases precipitously after 2 minutes, and providers will need to switch out frequently. Code nurses. These providers will operate the defibrillator and distribute medications from the code card as needed. Recorder. This person will keep track of how long the code has been going on and will record the timing of medication administration and defibrillations. Respiratory therapist. This person will provide BVM ventilations and other basic airway interventions until anesthesia arrives to establish a definitive airway. If the respiratory therapist is not present when you arrive, assign another provider to manage the airway. As additional providers arrive, codes can become crowded. When running a code, look for these additional key providers who can bring specialized skills to the resuscitation. Pharmacist. This person will help with the dosing and distribution of medications. If this person is not present when you arrive, ask the code nurse to distribute medications from the crash cart. Anesthesiologist. This person will provide advanced airway measures such as endotracheal intubation. Other physicians. House staff can assist with placing central lines, performing CPR, or assisting with airway management. Let's check back in with our code in progress.
Okay, that's great CPR. RT, I want you to keep bagging the patient. We're going to pause for a rhythm check. Stop CPR. Looks like the patient is still in V-fib. Back on the chest. Go ahead and charge the defibrillator to 100 joules.
You want 100 joules?
No, I'm sorry, 200 joules.
200 joules.
Go ahead and charge. I want you to stay on the chest until I give the all clear, and then I want you to back off the chest.
Charging
back
at
on the
200
chest.
joules.
Keep bagging. All clear.
Shock delivered.
Back on the chest. Recorder, how long have we been doing CPR for?
3 minutes.
Okay, let's go ahead and drop another milligram of epinephrine and continue CPR.
Another milligram of epinephrine coming up.
Again, role assignment and management priorities are made clear. When the resident gives an incorrect order, the nurse running the defibrillator repeats it back to him in order to gain clarification. In the intensity of a code situation, it is easy for orders to be missed or misunderstood. A technique that has been used with success in multiple settings, from aviation flight crews to surgical teams, is that of closed-loop communication. In closed-loop communication, each order is repeated back prior to being carried out. The loop ensures that orders are heard correctly by their intended recipient, but also by the person who issues the order. In the heat of the moment, it is not uncommon to misspeak when ordering a drug or a dose. Closed-loop communication adds an additional layer of safety. Let's check back in with our code in progress to see how it's going.
Good job, everybody. Keep up the good work on the CPR. RT, I want you to keep bagging, but you're looking like you're getting a little tired, so let's get ready for a switch. My next provider in line, good. I'm going to count backwards from 3. I want you guys to minimize the time off the chest. On my count, go ahead and switch. RT, you just keep bagging at that same rate. Ready? 3, 2, 1. Switch. Back on the chest. Good. Good. Maintain that same rate. 90 to 100 beats per minute. Good recoil. Hi.
Pharmacy is here. How
Yeah,
can I help?
hey, great. Thanks for coming. Go ahead and drop 300 milligrams of amiodarone, please. This patient is in a V-fib arrest. We've been doing CPR for 10 minutes, and we've given 2 rounds of epinephrine so far.
Sure. Amiodarone 300 milligrams IV. Got it.
Great. Go ahead and keep doing that CPR. That's good. Watch that recoil. Keep bagging the patient, please.
Our code leader maintains perspective on the overall resuscitation, recognizing the need for a change in CPR providers. As an additional provider arrives, she identifies herself and her skills are immediately put to use. Codes run best when there is one person in charge. Until you have turned over care of the patient to another provider, that person is you. It is important that you stand in a position where you can see all parts of the resuscitation: CPR in progress, airway management, and the cardiac monitor. This is usually at the foot of the bed. Speak loudly and clearly and make direct eye contact with each person you speak to. Code leadership requires clear communication. Be concise and clearly articulate your plans. Use names and direct eye contact whenever possible, and avoid rushing, yelling, or asking open-ended questions without an intended recipient. It is important that you actively manage the noise level and number of people in the room. Only essential personnel should be at the bedside, and you, as the code leader, should be clearly audible. Too many cooks in the kitchen spoils the soup, and you may need to kick some of them out. Code teams rely on strong followers as well as leaders. When acting in a supporting role on a code team, don't be afraid to raise concerns or to offer suggestions for the patient's care. If you are given a task that you are unfamiliar with or feel uncomfortable performing, ask for help. Let's check back in with our code in progress.
Epinephrine 1 milligram IV given.
Great.
Okay, let's see chords.
All right, nice job, anesthesia. Thanks for that. Let's go ahead and get that tube secured and confirm placement, please. Keep those chest compressions going. Rate could be a little faster.
Okay, good.
That's
breath
good.
Sounds, tubes in.
Okay, it's been a little while since our last rhythm check. Let's pause for a second. Oh, good. It looks like we actually have an organized rhythm on the monitor. I have a femoral pulse with that. Let's go ahead and cycle a blood pressure. Is he bagging easily for you?
Bags easily.
Good. Let's get him hooked up to an end-tidal CO2. Prep an amnio drip for me.
Blood
Pharmacy.
pressure is 106/80.
Great. And have some Levofed available. Let's go ahead and put some ice packs on this guy's armpits and groin and call the MICU and let them know we're on our way.
Will do.
In summary, being an effective code leader is a bit like being an actor in a play in that it requires stage presence. Position yourself to be visible to everyone in the room and speak loudly and clearly. In your simulation sessions, you will have the opportunity to practice each of the techniques described and demonstrated in this video.
We'd like to acknowledge the media production team for the Center for Health and Technology and the Center for Virtual Care for their assistance with this production.